This video provides a brief summary of a recent CRD project to scope and map the evidence on workplace-based interventions to promote health and well-being. It will first describe what we did and then present some of the key findings and conclusions. This project was commissioned by the NIHR Health Services and Delivery Research Programme in response to a request from NHS England, who wanted to identify research that was relevant to the promotion of healthy lifestyles amongst NHS staff. So what did we do? Well, we conducted a systematic scoping and mapping exercise, which involved producing a descriptive map of the relevant research evidence. We then assessed the potential for further evidence synthesis work. It is important to note that the evidence map was intended to provide a high-level overview of the extent and nature of the available research evidence from existing reviews and reviews of reviews. It was not the aim of this project to extract, evaluate, and synthesize findings from individual publications. All records identified from our scoping search were screened for potential inclusion in the evidence map against these selection criteria. As this slide shows, we look for existing reviews of studies conducted in any workplace setting, not just in the NHS. In total, we screened over 8,000 records and identified 408 potentially relevant publications. With such a large number of records, it was not practical to collect and assess the full text of all papers. Therefore, we produced the evidence map based on details reported in the titles and abstracts of reviews only. However, we did retrieve and examine in more detail the full text of a number of reviews which we had identified from the searches. We identified evidence related to a broad range of physical and mental health issues across 12 reviews of reviews and 328 other reviews. In addition, there exists NICE guidance addressing multiple issues of potential relevance. We also identified 78 protocols for reviews, of which 19 were focused on healthcare settings. In the results that follow, we are going to focus on the individual reviews and meta-analyses and the reviews of reviews. Okay, so let's start with the 12 reviews of reviews. We found reviews of reviews that addressed workplace-based interventions targeting various physical and mental health issues. We also found considerable variation between reviews of reviews in terms of the types of interventions assessed, outcomes, and length of follow-up. They also mostly reported evidence of effectiveness rather than findings relating to costs or the implementation of interventions. Now moving on to the individual reviews. We found 296 individual reviews and meta-analyses in total. As you can see from the table, we found a lot of reviews that focused on mental health, changing lifestyle behaviour such as physical activity, and on general health promotion. We also found 18 reviews on work relations, which address violence, bullying, or other unacceptable behaviour in the workplace. 15 reviews were focused on physical health, which included issues such as fatigue, sleep, and insomnia, particularly amongst shift workers. There were also 13 reviews focused on general work issues, such as sickness absence or absenteeism. When we just looked at the 95 reviews focused on healthcare settings, we found that the largest proportion of reviews addressed mental health issues and stress and burnout in particular. There was less focus on lifestyle-related issues and general health promotion. So, to conclude, it is clear that workplace-based interventions targeting health and well-being have already been reviewed extensively. Overall, we do not believe that further evidence synthesis work at this stage would be of value unless it addressed a clear need and it was possible to identify either a focused research question or a specific gap in the literature. It may then be appropriate to focus on a smaller number of reviews and conduct a more detailed examination of the available evidence, or, if necessary, undertake further literature searching and conduct a new evidence review. Our full report is available online in the HS&DR journal. The link to the report is provided in the description below.